Next drug, Metformin. I'm not sure how much press this has gotten, but last year there were two really important papers that came out, both in Nature Medicine. Just to revisit this, we know cancer therapies, including cranioradiation and chemotherapy, cause dysfunction, right? They cause a number of changes, including the precursor cells, these NPCs, these cells that make mature cells that do the important functions in the brain. They become stunted. They just kind of stop working and or die. We know that. That's one of the challenges or problems with our cancer therapies. They disrupt this normal pathway of making new cells. Some preclinical studies, again in mice, show that metformin, which is a drug for blood sugar, promotes new precursor cell formation after brain irradiation in mouse models. This group asked whether pharmacologic stimulation of these precursor cells would promote cognitive recovery and repair, again, focusing on this metformin drug. And they ran studies parallel in mice and humans following radiation. And they showed in the cranial radiation model that metformin enhanced or promoted the recovery of these cells, particularly in a really important area, the dentate gyres, which is an important hotbed for where these new cells come from. There were some sex-dependent effects, male versus female, on this effect and cognition that was really important. They also ran a double-blinded placebo-controlled crossover study. This is a clinical trial of survivors of pediatric brain tumors that were treated with cranial radiation, and they just showed a feasibility study. So again, these are 24 participants. They were treated over a 12-week period with metformin versus a placebo drug, and they showed roughly a 10-week washout period. And for a subset of patients, they found that metformin was associated with better performance than the placebo drug on a couple of different types of cognition, particularly memory, declarative and working memory to be specific. This was really strong evidence that this type of drug, like metformin, may have a role in treating cancer-related cognitive impairments. This was tested in the setting of chemoradiation-induced changes. We don't know a couple of things here, right? The pilot study did not show the efficacy, meaning this is feasibility. It didn't show how effective each dose was at getting this response. It also didn't look at what type of tumor growth happened during this period. The human studies were all in patients with long-term survivors of pediatric cancer with stable disease, not in people with active disease. So we don't know what would happen if you tried the same approach for people with active disease or residual tumor. Important caveats, really promising. This involves both mouse and human data.